Hi everyone. So today I'm going to be talking about a topic that I spend a lot of time talking about with my patients and I personally find fascinating and love talking about, and that is cholesterol. So today I'm going to be running through why cholesterol is important, what your numbers mean, and how you can try and improve them with some dietary changes. So for those of you who I haven't met before, my name is Dr. Shikha Chhabra. I'm a GP at Verve Family Doctors, and I'm also a lifestyle medicine physician certified by the International Board of Lifestyle Medicine. So I'll start off with just a couple of quick disclaimers. Firstly, of course, this is only general information. Make sure you have a chat to your GP about your specific scenario and if you're planning to make any specific lifestyle changes. And medications like statins and other things for lowering cholesterol have a role on top of lifestyle changes, and they're often life-saving. Please do not stop any medications without discussing it with your GP. What I'm going to talk about today in terms of dietary changes are often in adjunct to medications. And of course, diet is also part of a bigger picture, which includes things like weight management, physical activity, your genetics, and lots of other things. So we're just focusing on the dietary part today. I'm going to be referencing something called the portfolio diet, which I'll explain in a minute. And I have used some of their infographics cut up in bits here. So just disclosing they're not my work, and the original infographic is available at the website that I've cited here. So firstly, let me move this out the way. Why is cholesterol levels actually important? So when we talk about cholesterol generically, we often are referring to our whole lipid profile, which I'll run through in the next couple of slides what that includes. But there is a very, very strong link that we know about between lipids, especially the LDL, the low density lipoproteins. And we know that the link between the higher the level of your lipids and LDLs, the higher your risk of cardiovascular disease. That's a very strong connection. It's been proven time and time again. There's not really much dispute about it. We know higher LDL, higher chance of having cardiovascular disease. But we know that this process actually starts from infancy and possibly even in utero. So it's not something that's going to happen immediately and give you a heart attack tomorrow. This is something that is cumulative. And so the goal is really to minimize the number of years that you are exposed to high levels of cholesterol, LDLs in your blood. And what you can see here in this photograph is basically the outcome of when these fats start to accumulate in your arteries and they deposit in there and eventually cause more and more narrowing, which can be a problem. So when you see a result for a blood cholesterol level, it'll look something like this. So we'll see here a few abbreviations, which are CHOL for cholesterol, triglycerides, HDL, which is your high density, lipids, which are the good fats, as we generally call them, and you want them to be as high as possible normally. And then the LDL I've already mentioned, and then a couple of ratios here. So with your total cholesterol, we want that to be less than 4 whenever possible. And you might notice that the target ranges that I put in red over here don't necessarily match up with what's written here, which is the lab's normal ranges. So some of the labs have now stopped including the normal range altogether because they aren't particularly useful, to be honest. They don't correlate with what we know is the optimal levels for minimizing your chance of cardiovascular disease. So essentially, don't worry too much about them. Let's focus on the actual targets that we should all ideally be trying to get as close to as we can. The importance of that obviously varies depending on your specific risk factors. So total cholesterol less than 4, I already mentioned. Triglycerides, we like them to be at least less than 2. HDL, at least 1, but the higher the better. And then LDL, generally less than 2, but if you are very, very high risk, particularly if you actually already had a heart attack or stroke, less than 1.8. And then the ratios, basically the lower the better. So I'll introduce now the portfolio diet. So this is a diet, and I use the word loosely because I'm not a big fan of the word, because it tends to imply a short-term specific pattern of eating that you go on for a while and come off restrictive, etc., etc. I believe more in making gradual, slow changes to lifestyle that are long-term and achievable. But for what it's worth, the portfolio diet was invented or first researched by a doctor by the name of Jenkins. And he's the same doctor who actually developed the glycemic index, which is something we talk a lot about as well when talking about carbohydrates. So in 2005, he actually conducted a study, which was a pretty landmark kind of study in the field of lifestyle medicine. which he compared in which he compared three groups essentially. So we had one group were put on the low saturated fat diet, and that's kind of generally what a lot of people are advised when trying to lower their cholesterol. And then we had a group who were put on the same low saturated fat diet, but then also given a statin medication called lovastatin. So it's a fairly standard kind of dose, but just keep in mind that lovastatin is a low potency statin, so not necessarily as strong as some of the high potency ones that we will use now. And then he compared that with a third group, which is the portfolio diet. And the portfolio diet essentially was four different sets of eating changes or diet changes that have all individually been shown to be helpful for cholesterol, but he decided to kind of put them all together in kind of a portfolio, which is where the name came from, to see how effective they would be compared with things like statin medications. And the result was really encouraging in that it showed that the portfolio diet was actually as effective as going on the lovastatin combined with a low saturated fat diet over about 4 weeks when it was measured. So this is kind of what I base a lot of my recommendations on. And there are multiple other studies that support the various aspects that we're going to be talking about. But I just find it a nice, easy framework, which has been proven, so evidence-based, to help with lowering cholesterol levels. So the first part of the portfolio diet, number one here, is nuts. And that's probably the simplest one I find to get people to do. So you want to aim for 45 grams of nuts per day, and usually that's equivalent to about a handful. Obviously, they're very calorie rich nuts, so you don't want to go overboard, but a small handful a day is a great idea. You can mix it up with different types, and you can use nut butters as an option as well, but just keep in mind that you want to be choosing nut butters that don't have any added, ideally salt, sugar, or oils. So that's the first easy one, and that alone is usually causing about a 5 to 10% reduction in cholesterol levels. So the next one is plant proteins, and that's often one that people will struggle with, mainly because of the actual quantity that is recommended in the portfolio diet. So they are recommending that we get 50 grams a day, but as I was saying, it's not an all or nothing thing. Start by maybe trying 25 grams or whatever it is that you can start to include. And I'll run you through in the next slide a few options of how you can practically achieve that. So if you're trying to get to 50 grams of plant proteins, probably the two most potent options that we have are plant proteins through things like hard tofu. So all of these products are just things I've screenshotted from my recent Woolies orders. So I've got hard tofu here. If you're getting about 100 grams serve, you'll get 24 grams of that. And then the other one I love and something that I eat very regularly are the pulse pastas. They cook just like normal pasta. There's a quick and easy swap. So if you're getting this pea, lentil, and chickpea and barlotti bean pulse pasta, again, available at Woolies, that's about 26.8 grams in one serve. So if you're trying to get to the 50, even if you do one serve of tofu and one serve of the pulse pasta, that's your 50 for the day. But there's lots of other options that you can include as well. So for example, I've got my preferred option of soy milk that I drink personally is a Vitasoy Protein Plus that gives you, as it says on the bottle here, 10 grams per cup. And I also love using canned chickpeas and lentils. So if you're going about half a can, chickpeas, if you're making a salad or something, just chuck in half a can in there. That gives you 15 grams. Brown lentils I love as well, particularly if you're ever cooking like a bolognese or a sauce or a soup. You can cut out some of the meat that you would put in there and just chuck in half or a can, whatever it is, of brown lentils in there. You get 13 grams in half a can. Edamame, so soybeans are really great for snacking as well. If you get about 100 grams serve, you're going to get 12.6 grams of protein in there. And then veggie burgers are an easy swap out as well. Again, 10.4 grams of plant protein in there. And then things like quinoa and steel cut oats. So in a quarter cup of quinoa, which is not a very big serving, 7.1 grams, and 6.7 in a half a cup of steel cut oats. And speaking of oats, that also covers another one of the components. So the third component is viscous or sticky fiber. And as part of the portfolio diet, you want to be aiming for about 20 grams of that per day. And this will be in lots of different things, but particularly high in things like oatmeal, some of the beans and lentils we were talking about on the previous slide, and also things like barley. So you want to be trying to get maybe 2 servings a day of cereals like oatmeal, barley, and you can also use some supplement type things that can help to boost up that level, which I'll run through in a minute. But this is also the part that that explains why it's so important to have lots of fruit and veggies in your diet. So, getting the 5 serves of vegetables and 2 serves of fruit will contribute to getting all your viscous fiber needs. Vegetables that are particularly high in viscous fiber include the ones that kind of look a bit more sticky and slimy when they're cooked, like eggplant and okra. But don't let that put you off. They're delicious. I eat them all the time. And particularly fruits like apples, oranges, and berries are also very high in viscous fiber. If you do find it a little bit difficult to reach that 20 gram per day mark, or want to kind of add in something as a sort of insurance policy, then you can try adding in supplements like psyllium husk, which is what's the main ingredient in Metamucil, or you can buy just straight up psyllium husk from Woolies or Coles, wherever you get your groceries. And then the final product that I find a lot of patients like to use as well is called beta glucare, and that's available from a lot of pharmacies. And it's essentially just a concentrated form of the beneficial oat fiber. And they come in little sachets. You have 1 sachet per day. It can be either, what you can see here is a little crunchy cereal you can pop on your cereal or whatever you're having for breakfast, or a powder that you can dissolve into water or a smoothie or anything like that. So 1 sachet a day will be enough to kind of help you get to your viscous fiber needs. And then the final thing, and something that you probably would have heard a lot about, even if you didn't necessarily register that it was part of the portfolio diet, is plant sterols. So plant sterols have been shown in many, many studies to reduce cholesterol/LDL levels by at least 10%. And you want to be aiming for at least a 2 gram per day dosing. So plant sterols are something that occur naturally in lots of different veggies, but to really get enough of them for it to be useful for cholesterol, we have to get them kind of condensed down into a supplemented form. So supplement can be either a fortification of food products. So some of the common ones I've put into here are things like Flora Proactive, which is the heart healthy margarine you'll see advertised, the heart healthy milk, and they've got some heart healthy wheat bix as well. So most of these kind of pantry items or food products that market themselves as heart healthy, they've simply had the plant sterol supplement added into them and fortified. But you do have to be a little bit careful about the serving sizes to actually get the amount of plant sterol that you need. So, for example, with the Flora Proactive, to get the 2 grams of plant sterol a day, you need to be eating a whole rounded tablespoon per day, which is more than a single serving. And I'm not a huge fan of that, to be honest, unless you're someone who feels like they absolutely cannot live without a buttery spread and need to have a whole rounded tablespoon of that every single day. If that's the case, okay, swap it over to the Flora Proactive. But otherwise, it is a fairly highly processed food product and does contain some trans fat. So I'm not a huge fan, but if that's what you'd like to do, it does have the plant sterol in it. The heart active milk, again, you need to have about 2 to 3 cups a day to get the full serving size, but a reasonable option. And same thing with wheat bix. If you're eating wheat bix for breakfast anyway, you can definitely choose the cholesterol lowering variety. But if you're not including any of those foods in your diet regularly already at the recommended serving sizes, then you can also get the plant sterol in a simple supplement form. So probably the most common one that I've come across in my perusal of the shelves is the Blackmore's Cholesterol Health. I do not have any affiliation with any of these brands or sponsorships, just stuff that I've looked up and screenshotted off the internet. So yeah, the Blackmore's Cholesterol Health is 2 capsules per day to get you the 2 grams. So that's just a little quick kind of rundown of all the kind of really well-researched bits of dietary changes we know can help to reduce your cholesterol levels. But as always, take home message, don't do it on your own. Please go and see your GP. They can talk to you about what your levels are, what you need to be aiming for. And as always, medicine is never one size fits all. It's all going to be personalized for you, and they'll kind of discuss your risk factors and what your risk level is. And if all this kind of feels very overwhelming for you, remember it's not all or nothing. It's not about being on the diet or off the diet. It's just about looking at these are different things we know can help. Pick the one that feels the easiest for you, start with that, and gradually increase as much as you can. And finally, this was just a really, really quick rundown, but if you want to really get into the nitty gritty of it, I would really highly recommend seeing a accredited practicing dietitian. We do have one at Fur Family Doctors. Her name's Mandy, Zest for Life Nutrition. She's wonderful, and she can kind of really tailor things like this for you and look at what you're already doing and how to include things like this to improve your cholesterol levels and all the other chronic disease risk factors that we can improve with lifestyle changes. So I hope this was helpful, and I will be seeing you around at the clinic. Thank you.